Hello mate, my name is Zidhan Khotichalasta from Jakarta School Prosthetic and Orthotic. I want to show you about assessment of MMT scale, assessment for LLD, assessment for spasticity, and special tests at knee joint. For now, I want to tell you about MMT scale. MMT stands for Manual Muscle Strength Scale. For the strength can be categorized on a level from 0 to 5. In our example, we will use extension of knee joint. So the muscle which we're gonna test is quadriceps. Grade 0. No visible contraction. So the patient can't activate the muscle, so no movement is observed. For grade 0, ask the patient to contract the quadriceps. You can do this by pushing the back of his knee into the bench. For grade 0, I'll not see or feel a flicker or trace of contraction. Grade 1. Evidence of slight contraction but no joint movement. The patient can activate the muscle without moving the limb, so only a trace or flicker of movement is seen or felt during palpation of the muscle. For the grade 1, ask the patient to do the exact same thing, and this time you will see or feel a muscle flicker or trace the movement. Grade 2. For full range of motion without gravity. Movement over full range of motion can only occur if gravity is eliminated. In order to distinguish between grade 1 and 2, we have to bring our patient in side-lying position to eliminate gravity. Then I will support of my leg patient and bring into full range of motion, and I ask patient to extend the knee. If my patient is able to through the full range of motion, this grade 2. If no movement is possible at all, we're talking about grade 1. Grade 3. Full range of motion against gravity. The patient can overcome gravity and move through the full range of motion without resistance coming to the examiner. For grade 3, I will ask my patient to extend his knee against gravity. Grade 4. Full range of motion against gravity plus some resistance. So your patient can move through the full range of motion with moderate resistance coming to the examiner. For the grade 4, I will give moderate resistance against the extension of my patient knee. And then the last is grade 5. Full range of motion against gravity plus maximum resistance. So your patient can move through the whole range of motion against full resistance coming to the examiner. For the grade 5, I will give full resistance against the extension of my patient knee. In order to distinguish between a grade 4 and 5, make sure you compare both legs. The next is assessment for LLD. LLD stands for leg length discrepancy. We can do test for leg length discrepancy with Trendelenburg test to indicate the gluteus medius muscle weakness during unilateral weight bearing. For performing Trendelenburg test, Ask the patient to standing on one leg and at the examiner standing behind the patient to observe the relationship of the posterior pelvic structure. If the test is negative, the pelvic is the same level during weight bearing on the one leg, and for the positive, the result is the pelvic will drop toward the unsupported limb. We can also do tests of true and apparent leg length discrepancy with measure it. For the true one, the patient lies supine and measure from the ASIS to the tip of malleolus. From ASIS to the tip of malleolus. And the ASIS, tip of malleolus. And from the apparent, we measure from the umbilicus to tip of malleolus. And another test for leg length discrepancy is Galeazzi test. To do this test, the patient should be supine position and bend the hip to 45-degree flexion and 90-degree knee flexion, and make sure the heel is the same level. And if you want to assess the tibia, put your hand in the anterior of femur and see any gap or not. And for the assess the femur, put your hand anterior of tibia. Next is assessment for spasticity. We can use modified Ashworth scale classification. Modified Ashworth scale measures the resistance during passive soft tissue stretching and is used as a simple measure of spasticity. For scoring modified Ashworth scale, there have 0, increase in muscle tone, 1, slight increase in tone with a cage and release or minimal resistance at the end of range of motion, 1 plus, slight increase in muscle tone manifested by cage followed by minimal resistance throughout the remainder, less than half of range of motion, and 2, more marked increase in muscle tone through most of the range of motion, but the affected part is easily to move, and 3, considerable increase in muscle tone and passive movement is difficult, and 4, affected part is rigid in flexion or extension. For this test, so the patient in supine position and try to give passive movement, full range of motion, and give quickly movement. So I want to give example to dorsal and plantar flexor muscle tone. First, plantar flexor muscle tone. Give full range of motion and give quickly movement. Slide. And then for dorsal flexor muscle tone, give range of motion and give quickly movement. If there have rigidity, the score will give depend on how severe the rigidity is. And next, we have kind of special test at knee joint is a Lachman test to test anterior cruciate ligament rupture. For this test, the patient in supine position And bring your patient test leg into 30-degree arc of flexion and hold the femur in other hand and bring the tibia into slight external rotation and try to translate the tibia anteriorly. The test is positive if you experience a soft or mushy and feel, or if the anterior translation of tibia in injured leg at least 3 mm greater compared to the uninjured leg. Next is posterior drawer test to test integrity of the posterior cruciate ligament. To perform posterior drawer test, flex the hip 45 degree and knee 90 degree and just sit on the forefoot of the patient and try to push the tibia posterior. And what you're looking for is a translation of more than 6 mm or a soft and mushy and feel of translation of the